So our next speaker is well known to pretty much most of you guys. My good friend and colleague, an extremely knowledgeable and professional clinician. I'm happy to call him a good friend. And he's been on our board since the very beginning of this organization. Has been a big help that way, and is just completely innovative. Every time I talk to him, he tells me about something new that I never heard about. So I'd like you to welcome Dr. David Minkoff. I'll tell you a little bit about him in case you don't know about it. He graduated from the University of Wisconsin Medical School in 1974. He was elected to the Phi Beta Kappa of medical schools, the prestigious Alpha Omega Alpha Honors Medical Fraternity for very high academic achievement. He's board certified in pediatrics, and he has completed a fellowship in infectious diseases at the University of California in San Diego, which included research in developing new medicines to fight viral disease. As a clinical faculty member at the university, he also served as the co-director of the neonatal intensive care unit at Palomar Medical Center. And for 12 years, Dr. Minkoff worked in emergency medicine at the community hospital, Newport Richey, Florida, which ranks in the top 100 hospitals of the U.S. This emergency room has a chest pain center considered in the top 1% of all such centers in the United States. In addition to his traditional medical training, Dr. Minkoff has extensive postgraduate training in the complementary alternative medicine. The guy never stops. He's one like a lot of us. You just can't stop learning. He's addicted. He's an expert in functional medicine, chelation, allergy, elimination, European biological medicine, neural therapy, longevity, aging medicine, endocrine therapy, oxidative medicine, and ozone, insulin potentiated therapy. And that's just the first stuff that I could tell you about. With his training, he funded LifeWorks Wellness Center in 1997, one of the largest alternative medical clinics in the U.S., and this wellness center combines more cutting-edge alternative therapies and modalities under the same roof than pretty much any other alternative medical clinic in the country, and I can vouch for that. In 2000, he funded Body Health, a nutritional company which offers a unique range of dietary supplements in the public and practitioners. He's also currently the CEO of Home Health Works, an agency which offers in-home care, which was founded by Dr. Minkoff's wife, Sue. Dr. Minkoff is passionate about fitness, that's for sure, because he's only a 42-time Ironman triathlon finisher. Are you still doing that? Yeah. Okay, he just doesn't stop, I'm telling you. He also devotes time to writing and research. He writes 2 online newsletters each week, the Optimum Health Report and the Body Health Fitness Newsletter. I'm glad you had time to show up here to David, but thank you so much for coming in. Give him a warm hand.
How does this thing work? Hi, good afternoon. I was gonna, actually before I start, I want to acknowledge our godfather, Dr. Frank, and the godmother, Judy, and the goddaughter, Jolene. There would be no ozone therapy, really, I don't think, in the United States. There certainly wouldn't be an American Academy of Ozone Therapy without these 3 people. Talk about... So Frank has been endlessly innovative too, and inspires me. He's a year older than I am, I think. A couple years ago, he invited me out to Lake Tahoe to ride the Tour de Tahoe. So it's a ride around Lake Tahoe. I'm coming from sea level Florida to 8,000, and I think we got to 10,000 feet. And it's very hilly, and it was very tough, and he pulled me through it. So we had a good time. The other thing I want to note is that...
He pulled me through it.
What's that?
He pulled me through it.
The other thing I want to tell you is that we are winning. You know, there's a war going on for the hearts and souls of the human race. And last night, I was having dinner with Gary Brecka and his wife. And he told me a story that the Crown Prince of Dubai has a son who's autistic. Not real bad, but definitely not very functional. And in their society, there's no skipping eldest sons to who's going to be the next crown prince. And so Gary was asked to consult. Now, he's not a medical doctor, but he's super smart, and he's very perceptive, and he met with the kid. He did some methylation and other blood work testing on him, put him on a nutrition program which wasn't fancy. There was some hydrogen bath therapy. There was a few other things, a diet, so forth. And about a year later, the kid became actually very high functional, went back to school, started playing sports, started interacting with other kids his age. And so Gary was invited to come to Dubai to meet with the family, meet with the Crown Prince. And before he went into the room where all these people were, he was coached on who you say hello to first and who you bow to and the protocol that they keep. And so when he walked in there, the Crown Prince himself walked up to him, went down on one knee, took his hand, put it on the Crown Prince's head, and said, "Thank you, because you've saved my legacy and you've saved my son. And I'm going to make you, delegate you, a health minister, because we are going to change our country, because our country is in very bad shape. The vaccine had devastating consequences on them. He won't even talk to those people again. He said the average vitamin D level, because it's hot all the time and nobody goes outside. The women are appropriately covered, severe osteoporosis. And he said, I want you to direct a program so that we can, and I will implement it with an open-ended budget to make this country the healthiest place of any country. So that's amazing. You get one kind of enlightened guy who sees it, and they have a socialized medicine system there, so this can be implemented with really just like carte blanche. So I think we're winning. And really, I think all of us have our influences and our people that we can get to so that we can turn this thing around and actually create a society where there is health and there is vitality and there is longevity. So I renamed this Tools to Survive Against Weaponized Medicine. And I want to go through some things with you. So we've got to survive. We're not going to make it unless we survive. And to survive, you've got to overcome, and you've got to have decision and action. And then one of Gary's quotes that I like the best is that aging is the relentless pursuit of comfort. So if you've designed your life to be comfortable all the time, you're going to age faster. So the path is get hungry, get cold, get hot, get hypoxic, get breathless, if you want to be strong and resilient, and you want to live a long time.
So I came home one day from working at a job called Ecolab, where I sprayed for cockroaches.
Watch this.
Made $1,000 a month, weighing 300 pounds. And I got home and I watched a show on Discovery Channel of guys carrying boats and logs, Navy SEAL training. I walked in the recruiter's office and he looked at me and he said, "You're fat and you're black." I said, "I want to be a Navy SEAL." He said, "I basically had to lose 106 pounds in less than 3 months." I came back 3 months later, 106 pounds lighter.
I don't know if you know this guy, David Goggins, wrote 2 very good books. It's about overcoming, it's about succeeding, it's about going against yourself in order to get the best out of yourself. He's got the world record for the most pull-ups in 24 hours, something like 4,000 pull-ups in 24 hours. He's done hundreds of distance races, like ran through the Mojave Desert unassisted, 140 miles. Just an amazing guy and very inspirational, but with this sort of attitude and code of what survival actually looks like. And he's somebody that I just look up to immensely. So if you want to survive, you got to be able to soar, and if you want to soar, you got to be able to take the leap. You ready? All right. I want to do just a minute on our profession's checkered history. You know, we all got our black bag, and we were very excited, but if you kind of look what's happened starting way long ago, poor George Washington got bled to death. Camels were the cigarette that you smoked if you were a doctor. This was in the Journal of the American Medical Association. When I was a first-year medical student, my dad had a near-fatal heart attack. He was in the ICU. I remember going up there, didn't really understand it, and then we went downstairs and the cardiologist met with us, and he said he got the heart attack because he's been eating too much chicken fat and butter, and that what he ought to eat is bluebonnet margarine. If your doctor looks like this, find another doctor. You have to live it if you're going to be it. If you're going to be it, you got to do it. Dentists aren't on any reprieve. They're as bad as doctors are, except for a few of us in here. This was probably the worst thing that's happened in millennia. I don't know if you follow this lady. She's an MD, PhD. She's in South Florida. Her name's Anna Maria Mahalcha. She has a free newsletter. She's doing research on the nanotechnology that was inserted in the COVID vaccines. Yes, real nanotechnology. These are called mesogens. Mesogens are between a liquid and a solid phase particle. And they almost act like parasites. They are able to be manipulated from the outside electronically. She says this is the new nanomedicine, new smart Wi-Fi communication systems, weapons, industrial espionage device, or component for mind or body control devices. Now, for those of you that are doing dark field, you've probably seen these things. I never saw these things before 2021. Now we see them in 80% of people. These are hydrogel nanoparticles that self-organize and cause actual structures. And here's a couple examples of them. 80 to 90% of the people that we're seeing, even unvaccinated people, because I think there's a shed factor with this disease, and people who weren't vaccinated get it. Now, the statistics for the vaccine, in May when it came out, 95% were protected. In June, well, 70% were protected. Oh, July, 50%. Oh, August, well, it doesn't protect you, but it reduces spread. September, well, it doesn't reduce the spread, but it reduces the severity. October doesn't reduce severity, but reduces hospitalizations. November doesn't reduce hospitalizations, but you're not going to die. In December, you're going to die, but you're going to go to heaven. So if you look at the cumulative statistics of the results of big pharma, big agriculture, AMA, this is what we all see every day. My practice is, it's all these people. And just look at the staggering increases in it. And it's not an accident, this is caused. About 75% of the patients that we see in our clinic have cancer. Wall Street Journal is calling it turbo cancer. This is a study from England and Wales, but it's representative. If you look at the left side of the graph, 2020 through 2021, the various cancers, then you look at 2022, and you see that the incidence of breast, brain, colon, melanoma is soaring. We have never seen so many young people in our clinic, 28-year-olds, 32-year-olds, presenting with stage 4 colon cancer, breast cancer, melanoma. Extraordinary. These are diseases that people never got until they were 60 or 70 years old. And now we see them every week. So if you want to live long and be healthy, you can't die of the things that kill people when you're too young. So leading cause of death in the United States supposedly is heart disease, second is cancer. I heard from Nasha Winters that actually in industrialized countries, the incidence of death by cancer is 2-to-1 over heart disease. These are old statistics, 2019. This isn't what's happening today. So really, if you look back here and you look at 659,000 people died of heart disease, if you just look up the statistics on iatrogenic deaths in the United States of 2019, there were 760,000. That's the most, that's the real number one. Iatrogenic is due to the activity of a physician or doctor-prescribed therapy, whether intended or not. For the pandemic years, how many millions died? The WHO says 3 million. I think Dr. Anita told us 2 days ago it was more like 17 million worldwide. So quite a disaster. There's actually one more cause of iatrogenic death that isn't these, that's really probably number one. Does anybody know what it is?
Properly prescribed medication.
That's included in the iatrogenic deaths. I never thought of this before, but last week I was thinking about it and it just dawned on me when I saw this statistic. 395,000 babies killed by doctors. This is iatrogenic deaths. Whether your politics on this or not, it doesn't matter. But as healthcare practitioners, this is a staggering thing as a representation of a society or of a group of people committed to wellness and health. Okay, so the whole societal morality has changed. You know, if you gotta lie, well, you just lie. If you gotta steal, well, you just gotta steal. There's people taking over houses where the person hasn't been there in a while and settling in the houses, and then you can't get them out of your house because they have a right to the house. You have a right to cross the border because you just have a right to cross the border, and then you're given money, and then you're given all this stuff. It's just like it's become insane. So the mentality is, I'm a victim, it's not my fault. Drugs heal, drugs make you free. Truth is what you decide it is, and when you change your mind, well, it's that. God's dead and his commandments are obsolete. So the bulwark of the culture of Western civilization has just basically been thrown in the trash. And here was a very kind of interesting little cartoon. Kid says, Mom, what is a contradiction? Well, believing that 18-year-olds couldn't understand their student loans, but 7-year-olds can choose their gender. Makes total sense. This was Time Magazine, 1966. Probably more true today than it was then. Okay, so my question really is, how can we live as long and as well as possible in this dystopian world? What are the tools that will do that for us? If those tools work for me, they'll probably work for my patients. So I feel like my life's an experiment to try to figure this out. So I want to just give you some of the things that to me work and make sense. So if you don't have a goals list for your life, you ought to write one down. I want Moses lived to be 120, so that would be great. I want to keep working because it's the most satisfying thing I do. Try to find what actually is true and what isn't. I'm still competing in triathlons, and my wife and I are always either first or second in our age group on all the races that we go to, so it's still lots of fun. I want to win my age group at the Ironman World Championship when I'm 85, so I've got 9 years to prepare for that. Write some more books, have a lovely family, 9 grandchildren. I was once a pretty good guitarist. I want to pick that up at some point. Write a rock opera and start a good medical school. So one of the basic things that I review with every patient, and you all know this, but every time I go through it and I think about it, it just resonates to me how amazing and what a miracle life even is. So if you take a cell and you just inquire, take that cell and put it in a petri dish and say, what is going on there for that cell to stay alive? It's got to get in nutrients, it's got to get out waste products out, it's got to be able to construct its own internal organs and repair them, and it's got to be able to produce enzymes or hair or hormones or whatever it does. And if you ask the question, how many reactions are going on in that cell per second? It's in the neighborhood of about 100,000 enzymatic reactions per second. Now, there's roughly 100 trillion of those in an average-sized human body. So you take this problem to the smartest computer engineer and you say, I've got a single entity which works at 100,000 reactions per second, and I've got 100 trillion of them. Write me a program and a computer hard drive so that you could produce all the stuff that goes on in the body on a millisecond basis. So that you can function, you can breathe, you can run, you can get in cold, you can get in hot, you can throw a football 80 yards, or you could hit a Nolan Ryan fastball. The amount of coordination and infrastructure, and oh, by the way, the whole computer's got to fit in a 3-pound little package, which is your brain. It's so totally impossible that this thing had to be a created thing, because evolution doesn't ever produce more complex structures out of simpler structures. There's no 2-celled microorganisms or 3-celled. There are single cell, there are multi-cell, but there is no logical progression that way. And I think, and the other interesting aspect of this is almost all of the communication that comes into the body that's pertinent is electromagnetic communication. So sight is electromagnetic communication, and sound is electromagnetic communication. And that's how we get our information. And then this system reacts to that and then does all the right things mostly. So so I tell the patient, listen, if your mother was decently healthy when you were born, your functioning was good. But just like a brand new computer, if you hook up that computer to the internet after a couple of years, the communication structure gets broken down because there's interfering influences like malware and spyware, and someone spills coffee on it and there's dust in the room, and then the computer doesn't work, and you push send and the little circle goes around and around and it doesn't happen. And that's what our sick people, or all of us to some extent, but sick people, that's what's wrong with them. Their network is interrupted by chemicals and toxins and viruses and Lyme disease and EMF and all the other stuff. And to get you better, we have to basically perform the same thing that a computer guy does who finds the virus and quarantines it, or the malware, or reworks the program so it works. And so basically there's only 3 things that go wrong in the body. There's things that are in it that shouldn't be there. Toxins, infections, that sort of stuff. There's things that are missing from it, which gotta be there. And there can be structural imbalances which interfere with the communication network too. And so when people start to understand that, like, here's what we're doing. Through our various diagnostics, we're gonna find the stuff that's in you that shouldn't be, and we're gonna find the stuff that's missing that needs to be there. And we're gonna send you to the chiropractor or the physical therapist or the acupuncturist to work, and the dentist to help with the structure so that we have an operable machine. And then people get better. 85, 90% of the people get better. And that's sort of the model that's very workable, and people understand that. Why are you doing this? Well, because that's a toxin that shouldn't be in your body. So the other thing I want to mention here is that we are living in a sea of life. The number of bacteria in the body is like 400 trillion. So there's 100 trillion of us, of my cells. There's 400 trillion bacteria who all have a life influence on us. Very complicated. Then the amount of organisms around us per cubic foot of air, between 1.6 million and 400 million viruses and 860,000, 11 million bacteria. Just on the surfaces, we touch it, we interact with it all the time. And this is our life. And we were built to be in this environment. And when we get ourselves right, then our environment is supportive of us. So what's a biohack? Strategic biological experimentation, especially on oneself, with the goal of enhancing or augmenting performance, health, mood. So it's taken on as an individual activity. So I have a whole bunch of them, and I'm going to run through some of them with you. Now, methylene blue is quite a remarkable substance. I've been using it for about 3 years. I take it every day, about 60 milligrams. It has remarkable biochemistry, and it is able to shuttle electrons. It can oxidize and reduce. It can take iron from +2 to +3 to +2. It can turn on all the iron-related compounds in the body, the cytochromes and the hemoglobin, to make them functional. And it can reduce, or it can oxidize NADH to NADP so that you can get your mitochondria working. And probably to a certain extent what's happening is in the electron transport chain, there is plastics and chemicals, and some of these things are unable to transfer electrons, and NAD can do the electron transfer. So it improves mitochondrial respiration, improves brain energy, it improves cognitive performance, it prevents mental decline, it's neuroprotective. It upregulates NRF2, it's an antioxidant, it raises nitric oxide, it can be a vasodilator. It can upregulate the number of mitochondria per cell and increase the number of mitochondrial reactions per mitochondria. It will cross the blood-brain barrier. It can be toxic if overdosed, so we don't go above 200 milligrams. Half-life is pretty long, it's about 12 hours. It can be helpful for bladder infections. I just had a nurse practitioner who had that I consult with, and she had an older patient who could not resolve their UTI, 3 rounds of antibiotics. She gave her 60 milligrams of methylene blue PO 3 times a day, and in 5 days her symptoms are gone and her urine went sterile. This is an old treatment for urinary tract infections. Now, when you take methylene blue, you have blue urine if you're taking enough. So you always know if you're that it's getting in your blood and it's working. The caution on methylene blue, because it isn't controlled yet as an oral, I'm sure it's going to be. I have been consulting with Dane because I wanted to be able to produce it for people, and he says you can't do that because the FDA is going to say it's a drug at one point. It is a drug for IV use, and I remember using it in the emergency room for a patient that had carbon monoxide poisoning, and it will reduce the hemoglobin so that the blood then works again. Anyway, you want pharmaceutical grade product because a lot of the products are contaminated. They're over the counter. You buy them over the internet and they're full of chromium and they've got bad stuff in it. So you just have to watch it where you get it. When it's blue, it's oxidized, and if you take vitamin C with it, then it turns clear. Any process where you're using an oxygen-based therapy, or you need an oxygen-based therapy, or there's been oxygen deprivation injury like CBA, TBI, post-op, exercise, methylene blue is helpful. There's a neuroprotective effect. It promotes autophagy and inhibits microglial activation in the central nervous system. It has broad-spectrum virucidal activity, so it's very broad. Now, this is my source. He's a pharmacist. It's a liposomal product. Gene Bennett at ALT, he has a new one, which I just started to try yesterday. They have a very fine product too, but I don't have experience with it. This one, these guys will sell to health practitioners, so if you want to try it out, you can. Now, a couple of years ago, I talked to you guys about V cells. I'm still very excited about it. V cells are very small, embryonic-like cells. This is a stem cell treatment. You take the stem cells out of the person. So these cells are, how many were here 2 years ago? Okay. So at conception, stem cells are generated. A bunch of them are not utilized to build the body. They are held back in reserve, and they're circulating all the time. They have never been activated. So the downside of taking fat or bone marrow and creating stem cells is if you're working on a 60-year-old, those cells are 60 years old. And while they may be helpful, the potential is way less than they could be if they were new ones. So these guys are new ones. They've never been activated. They're in the bloodstream. They're very small. They're about 3 microns. The other problem with mesenchymal cells is they're big. They're 30 microns. Most of them don't get through the lung if you're doing it as an IV treatment. These guys are very small, and they penetrate the blood-brain barrier. They get through the lung, and they can be activated by a very special laser, and there's a guy who teaches a course, and you can go to the course, and you can do these in your clinic. And we've had some remarkable results with these cells. So if you want anti-aging, and you have patients that want anti-aging, and these cells can be used in joints, they can be used for there's 6 published papers this year alone on using these cells for cardiac restoration, people with chronic congestive heart failure, ejection fractions 15%. In 6 weeks, doubled the ejection fraction with 1 treatment. So it can be pretty remarkable. So I'm just mentioning it to you. I'd look at it. It's this laser is very special. It's called Song laser, and you can get more information on that. If you go to our website, lifeworkswellnesscenter.com, and you just search V-cells, you can watch the presentation I gave here 2 or 3 years ago on this, and you could see the whole thing with case reports. But I think it's a great therapy. Now, some years ago, I learned about this next treatment with here, because these guys were exhibitors here. And we've had some lectures this week, which were great, on using hypoxia to stimulate stem cell activation and healing. I think this technology has taken this to the highest level that I know of, which is, this is a great big bag that you fill up with oxygen. So there's an oxygen concentrator, you fill up the bag with oxygen. You get on a bicycle or on a treadmill or on an elliptical, and you put a mask on, and for about 3 minutes you breathe the 92% oxygen that's in the bag. After 3 minutes, you do an interval type where you do 1, 2, 3 minutes, but before you start the interval, you turn the oxygen concentrator or the bag off, and it takes you from 92% oxygen to about 30,000 feet. So now you are being given a hypoxic stimulus and you're working. So it's high intensity, you can hear the heartbeat in your head, it doesn't feel that great. You wear a pulse oximeter, and right now I'm usually between 68 and 72, and I can hang on for 2 or 3 minutes. And when you start to get a little tippy or dizzy, you turn the 100% oxygen on and you rescue. And then when you've rescued, you take another dive. It is very stimulating, and it increases the oxygen level in the brain. So the study was done with these sensors. They can sense oxygen, true tissue oxygen concentration through the skull. And you can measure the oxygen depletion and repletion during the session. You actually increase brain energy by 29%. It's huge. And you get a neurological performance boost that lasts for hours. I'm just going to show you one of these things. So, at the beginning of the graph, he's now going to go do his HIT session at hypoxia. And this graph shows the oxygen goes down by 20%. So if you're at 99, you're going to 79. Then recover, again, recover, again, recover. Now you get a big spleen dump when this is happening, so that you mobilize red cells from your spleen. You milk out every darn toxin that's in your brain while this happens. And then in well-trained athletes, without an oxygen recovery, you get what they call an ecstasy state, where the body figures out how it can get the brain oxygen up without any oxygen, and you're still breathing at 78 or 79 PO2. So it's pretty amazing. And it's something that anybody can do, because you don't have to push it hard, you just have to get hypoxic and rescue with oxygen. So this is cases, there's a little hard to look at, but if you look on the right side of the graph, so this is a thorough neurological exam. So you see on case 1, there's some in the low, there's a bunch in the low average, there's some in the average, and then there's none in the above average. And then after working with this technology, you see none in the low, very low, none in the low, none in the low average, and you see a bunch of them that are now above average. This is neurological performance in the same person. Here's another case. If you look across the top, whole bunch of red ones. Look across the bottom, only one red one. A lot of the red ones have turned to green, like improvement in complex attention, reaction time, cognitive flexibility. Like amazing executive functioning. This is all objective testing. And so people post-TBI, post-stroke, as long as they can move something, they can do this. Here's another one, same thing. Takes mediocre performance and improves performance just by increasing perfusion to maximize brain oxygen. You get 4 times the blood flow in your brain when you do this, and 6 times more oxygen in the plasma when you do this, and 24 times burst in non-hemoglobin-bound oxygen. So 29% increase in O2 utilization in the brain. That's pretty good for a very low-tech measure. So I got one at home. They cost about $5,000, and I try to get on there 3 times a week because you really do feel it. Okay, now some of you are probably familiar with Wim Hof. He rigged up a way to do this without any equipment. So if you do 40 breaths, hyperventilate, and then you hold your breath as long as you can, and you put your pulse ox on, I can hit middle 60s. And so you can sort of do this yourself without oxygen. One of the things I like about this is one of the ways to get strong is to challenge yourself with cold. So I got one of these at home, and I get in it almost every day. It's about 50 degrees. It's cold. But that's my grandson. He's not so keen on it. But look what it does. It generates cold shock proteins. What are cold shock proteins? They quadruple protein synthesis, scour the blood for free radicals, help you maintain muscle mass during periods of disuse, help decrease inflammation, faster wound healing, thermogenesis, brown fat. This next one is really good. You take a hit of cocaine, the dopamine surge lasts about a couple of minutes. You get in the cold and measure dopamine levels, they're just as high as cocaine, but instead of lasting 9 minutes, it lasts about 2.5 hours. So if you want to get dopamine, sit in the cold. Now, all of these things turn up mitochondrial performance. Frank is the master of mitochondria. We have his mitochondrial testing machine. If you guys don't have that machine, you should get one. Every patient gets a resting basal metabolism where the inspired and expired gases are measured. It's the most reliable and accurate indicator of thyroid level, and you will diagnose probably 30% more people with hypothyroid because their resting basal metabolism is 80 or 85, and it should be 100 to 110, and their blood level will look okay. And you put them on some thyroid and you rehab them. So it's one of the best investments I ever make. And for the gung-ho people, you could actually really do mitochondrial function where you exercise them and you can see what their VO2 maxes are, and you can help them, you can prove to them that their performances are increasing. So ATP can't be stored. It's got to be made all the time. Amazingly, one body, the mitochondria in one body, could light up 1,200-watt light bulbs of power and keep it going all day. Mitochondria produces 10,000 to 50,000 times more energy per second than the sun relative to their weight in the form of ATP. Another one of these miracle things is just amazing. Now, for the time-challenged person who's not a regular in the gym, by the way, I'm not affiliated with any of these people I'm showing you. These are just things that I bought that I utilize at home. So this guy he's a PhD physical therapist. He's got a whole chain of clinics around the country that rehabs people with osteoporosis, OsteoStrong. It's a great program. It really works. But he's 10 minutes a day, you can get a physique where you're strong. Using these bands, it's too simple to believe. It really actually works. Here's all the references he's got for what he's doing. Now, one year I gave the group a whole hour talk on this subject, and what I find is that almost nobody has taken it to heart or actually looked at it. To have a successful integrative medicine practice, you need a couple of people to help you. You need a biological dentist who can handle your cases. So we were thinking this morning, we were talking to Dr. Bludgett. He said, how many people are you referring to dentistry every year? Probably about 400. 400 patients that originate in our practice and end up in a dentist's office. And we filled up all the dentists in Tampa Bay. And I said, why don't you come to Tampa Bay, and because we need another dentist. If any of you are dentists and you know how to do this stuff, you handle cavitations and root canals, well, come talk to us. Because there's a super need for this. The other thing that you need is that you need an upper cervical chiropractor. This is the least known, least appreciated, most important area of chiropractic that I know of. So, it's called cranial cervical syndrome. I'm just going to give you a very fast overview. But probably a third of the patients I see have one of these or more of these symptoms. They've got headaches, they've got neck pain, they've got they've got pressure, they've got drop attacks, loss of balance, constant dizziness. They've been to the ENT doctor and he's done all the vertigo studies and he can't find anything wrong. All the people with heart irregularity and paroxysmal atrial fib. A lot of these people have their vagus nerve impinged on by C1 and C2, and that's their problem. And the neurologist will never figure it out, and the cardiologist will never figure it out, but you can figure it out, and you can save people by the bucketful. Okay, numb legs, difficulty walking, vertigo on standing. Here's just one of my favorite cases. This guy's a lawyer from Slovakia. He hadn't been able to work for 5 years. I was the 17th doctor, and he said, you're my last shot. He said, if you don't cure me, I'm going to kill myself. Pressure on the top of my head. And he said, when the pressure is at the top of my head, I feel like I can't be in my body, and I'm actually pushed out of my body, and it makes me feel crazy. Because here's the body, and here I am, and I can't get back in the body. And I've got this whirling, spinning sensation, and I'm depressed, and I don't want to live. Okay? Now, I'm going to see, can we try this? Now look on the left-hand one. Now this is a contrast study looking at cerebral spinal fluids. So before we start this, the way it works is that cerebral spinal fluid is produced in the third ventricle. The brain has no lymph system. The way it cleans itself, so the brain is the most metabolically active organ in the body. About 20% of the energy needs of the body are in the brain. And so the brain has to be able to rinse the cells of their metabolic waste and get it out. And the way that it does it is the CSF goes from the inside ventricle, washes through the parenchyma to the outside where the CSF is collected. It comes down through the neck, past C1, back into the thoracic duct. Some of it recycles into the cerebral spinal fluid around the spine. Now, so this is an imaging. This is done at the University of Rochester. Do I start this or do you? I click it with the pointer. Okay, watch the left. You can see the contrast on, see the contrast? There should be contrast on the left, and there's almost none. This guy has got a backup of cerebrospinal fluid and it's not coming through. Now, one adjustment later, one Atlas adjustment later, can you click? There we go. Now look at the right side. See the flow? Now the flow is coming. Now here is an MRI. The left one, that Atlas is rotated 20 degrees off what it should be. If you look at oops, sorry. Pointer. That's too far to walk.
That's the bottom button on the left.
Oh, on the left. Oh, there we go. So if you look right, where do I put it? At the computer?
You don't need to.
Oh, there it is. Okay. Here is the jugular vein, right there, that black. See it? It's pushed closed on this side. There is obstruction. There is backflow of venous blood and CSF from physical obstruction. The one next to it is one adjustment. It rotated back about halfway. The jugular is still, the jugular vein is still closed. But the difference in those two images was just this adjustment with the earlier one with the CSF flow. Now this makes a huge difference in a person's brain function. So he recovered. It took about 3 months. And he got married, and he's a happy guy back in his country. Now, we have had hundreds and hundreds of people like this. So you go after their Lyme, and you go after their symptoms, but there is a structural component to this which is very important. And I just recommend that you find an upper cervical chiropractor. There's a couple of different groups that do it, but they're very highly skilled, and they can really help you. Now, so I went to get my own done, okay? And I don't have any symptoms, and I'm doing a lot of things where I'm rotating my neck. I never had any really severe head trauma. I've never had a TBI. And the first exam that the chiropractor did to me was he checked my range of motion, which was limited, and he said, close your eyes and walk in place for 50 steps and don't open your eyes. And so I start doing it, and then I count to 50, and when I open my eyes, I was over here. Okay? It's a perception imbalance. So he does the x-rays on me, and if you look C1 Atlas lateral displacement, pre was 1.54 degrees, post 0.21 degrees, 80% correction of my C1 lateral displacement. I don't really notice that I have symptoms. C2, 60% improvement. Lower neck, these 98%. C1 Atlas rotation, 22%. So it was a 67% improvement. And when I finished that series of treatments, which is like 3, painless adjustments, they don't do the regular chiropractor whiplash adjustments. It's a very targeted thing. He said, okay, let's redo the test. Close your eyes, march in place for 50 steps. And when I opened my eyes, I was in the same place. It is really something, it's really helpful, and you can help your patients with it. Next one, there's a worldwide epidemic of fatty liver disease, okay? It's even being glorified, okay? Swimsuit issues. He says, embrace the chub. Go to the grocery store, you'll see this all the time. okay? So it's an accumulation of fat in liver cells. It's increased uptake of fatty acids, decreased export. They're all insulin resistant. They have high blood sugars. They have high insulin. And they get fat in their livers, and their livers get inflamed. And they go from non-alcoholic fatty liver disease to non-alcoholic steatorrheic hepatitis to cirrhosis. Over 1 billion people at least have it. It's probably 60% to 70% of the American population, if you just look at people. Fructose is a big enemy, high fructose drinks. Okay, every cell in the body can use glucose for energy, but none can use fructose except the liver, and it goes to the liver and it accumulates as fat. I'm gonna skip this. So the guy on the right has it, and the guy on the left got cured. So there was once a king in a far-off land, and he was trying to figure out what was the secret of life. And as he grew old, he decided he was going to put the question to his people, and he said, anyone who can figure out what the bottom line secret to life is, I will give them half my kingdom. And he got 10 volunteers to say, we're going to go for it. And he said, if you come back and you don't have the secret, I'm going to chop off your head. And if you have the secret, I'm going to give you half my kingdom. And you got 3 days to do it, and after 2 days and 23 hours, all the 9 people had come back and they'd lost their heads, and the last guy came back and he saw all the heads laying on the ground, and he said, I've got the secret. And the king said, what is it? And he said, I'm going to whisper in your ear. And he whispered in his ear, and the secret was, there's no such thing in life as a free lunch. You can't have health and eat ding-dongs. You can't have health and sit around all day. You can't have health and not sleep. You can't have health and not work out and build your muscles. You can't. There is no free lunch. It won't work. You have to eat organic, exercise a lot, get some sunshine, poop every day, sleep enough, get enough supplements, have friends, challenge yourself to do hard things, and figure out a purpose. So I won't belabor this. This is my routine, and I'm trying to work in all this stuff so that I can keep my health too. And I have a whole supplement program. These are in the notes. You can see this stuff. Sarcopenia kills. Your brain is as good as your muscles, and you're losing muscle every day. And you have to figure out a way to get a gram of protein per pound of body weight in every day, which is very hard. On the bottom, if you take one of the amino acid mixtures like Perfect Amino, and you take 2 scoops twice a day, so I'm 165 pounds. I can get 60 grams of protein on 2 scoops twice a day and virtually no calories. And then if I eat 2 meals that have 50 grams of protein, you know, I have 6 or 7 ounces of meat or fish, I can meet my goal, and it helps me to keep my muscles. 3 days before we got here, my son-in-law had built a gym in his garage, and he had a new little, like, structure thing. And so I was sitting in there with the grandchildren, and I challenged them all, who could do the most pull-ups? So the little 4-year-old jumped up there, and he almost made one. And then the 12-year-old, he did 3. And then I thought I was going to get away with not having to do it, but no, you got to take your turn. So I did 15 pull-ups in front of those guys. Now, I used to be really strong. I did gymnastics in college. But to keep that, you got to work it. You got to work it. Now, the other thing is we're inundated with toxins. I happen to know this product. This was a little study that we did in our office. Look at the increase in excretion. So this is 10 people. Get the urine sample for toxins. Give them 3 days of 2 dropperfuls twice a day of metal-free and chemical detox, and then look what comes out. Glyphosate increased 200%, DEP 962%, styrene 257%. We're all full of this stuff, and you gotta keep it coming out, even if you try to live clean. Now, we do the genetic testing in our office and the epigenetic testing. So on this one, I'm 75. My immune intrinsic age, which means my basic immune system, I'm testing at 64. In my extrinsic, which is my adaptive immune system, it comes out 47. So if you do this stuff, you can show that you can actually stay younger while you're getting older. My telomere length is increasing if you look at the graph. Now, the most important metric of longevity and health is VO2 max. That's how much oxygen you can use in a given unit of time. Okay? And on Frank's machine, we test people with VO2 max all the time. Okay? So VO2 max is a strong indicator of longevity. It is more strongly associated with reduced mortality risk than any other metric we know of. And this is likely because it's the best integral function we have for exercise volume and intensity. So you look at the graph, the older you get, the worse it gets. And I'm sitting at 42, and they don't go up to 75. But if you're over 40 at 75, you're doing pretty good. But it's not an accident. It is working it so that you can do it. I don't have time for that. 81 years old. 3-hour concerts. Walks 12 miles, equivalent of 12 miles during the concert. Not bad, huh? Okay. He's got a very solid workout routine, very solid diet routine. You know, somebody made a joke. They said, you know, you got all these old guys, McCartney and him, and they're still going. And he said, you guys ought to talk to the rappers because they're using the wrong drugs. All right, I'm going to wrap it up here. So when all is said and done, truth is we're spirits. We inhabit bodies, they age and die, we live. That's the cycle of life. If we serve successfully, it means we help many and we love more. So medicine has tools for healing, but it's sold its soul for profit. But heart and spirit really do it. So our practice is, we are heart and spirit doctors. Yes, we have technology. Yes, we do things. But our communication with the patient is the important thing. It's the healing force. And so that's why they come to us, and that's why they like us, and that's why they refer our friends, because if they get connected with their bodies and their families and their groups and their animals, they can be healthy. And if they're not connected, they get sick. And you can't heal a sick soul or a sick heart with ozone alone. You have to get to them. They have to be heard. They have to be acknowledged. And then they will get well for you. Now, quantum physics is like another world compared to regular physics. So gravity and levers are regular physics. Quantum physics is outside of time and it's outside of space. You've probably all seen this experiment where they take a laser beam, they split it. One goes this way 7 miles, one goes this way 7 miles. They put an influence on the laser beam over here, which is 14 miles away from the laser beam over here, to bend this laser. And they want to know if we bend this laser, they're coming from a common source, will the other laser beam bend? And how long will it take? What's the lag between when this one bends and this one bends? So they got an atomic clock which measured seconds down to the millionths of a second. And they did the experiment. And guess how long the comm lag was, the communication lag was, between when this one bent and this one bent? Zero. The quantum universe is not time and space, it's outside. We are quantum beings. And so that's how healing takes place. And so it's a heart function. If you go back in the Chinese or Indian medicine, you know, it's loving, it's empathy, it's open-hearted, it's serenity, it's emotional balance, trustfulness, tolerance. If you look at the world today, it's all the heart imbalance. It's loneliness, criticalness, jealousness, cold-hearted, narcissistic, heart and lung problems, asthma, allergies. Okay? So good poetry is a quantum communication. It's not a word communication. So I'm going to do an experiment with you now. I want you to close your eyes. E. Cummings is an amazing poet, and he wrote a poem about the heart. And he says, I carry your heart with me. I carry it in my heart. I am never without it. Anywhere I go, you go, my dear. And whatever is done by only me is your doing, my darling. I fear no fate, for you are my fate, my sweet. I want no world for beautiful. You are my world, my true. And it's you, or whatever a moon has always meant, and whatever a sun will always sing is you. Here is the deepest secret nobody knows. Here is the root of the root and the bud of the bud and the sky of the sky of a tree called life, which grows higher than soul can hope or mind can hide. And this is the wonder that's keeping the stars apart. I carry your heart. I carry it in my heart. Thank you very much.